And welcome to the Dr. Bob Show. Have you ever worried about your heart? Do you know what heart valves are? Do you know what their purpose is, the heart valves? Do you know where the aortic, the pulmonic, the tricuspid, and the mitral valves are? Do they cause problems? Do they cause symptoms? What are those problems and symptoms? My guest is Dr. Malcolm Foster. Dr. Foster is a board-certified cardiologist, and he deals with valve problems in the heart every single day. We're going to be learning a lot on this show. You're going to want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist, board-certified in the heart. Malcolm, welcome to the Dr. Bob Show.
Thank you, Dr. Bob.
So what are heart valves?
Well, we have 4 heart valves.
We have 4 of them?
Yes.
What are they?
4 chambers of the heart and 4 heart valves. We have the aortic valve, the mitral valve, pulmonic valve, and tricuspid valve.
Which is most important?
I'd have to say the aortic valve.
Why do you say the aortic valve is the most important valve?
Well, when the heart, the left ventricle, the pumping chamber, is pumping the blood, it gets ejected from the heart through the aortic valve.
So it goes to the aortic valve,
yes,
and that throws it out to the rest of the body?
To the rest of the body, yes.
What if there's a blockage there? What do you call that?
So if the valve starts to become narrowed over time, so we say a sticky valve or stenotic, aortic stenosis.
And so what's aortic stenosis like when you examine a patient's pulse or when you listen to it? What's it sound like to you? How does a person know if they're having that?
Well, the person, it may be difficult because it's a slow process, but they tend to develop shortness of breath, they can develop chest discomfort, they can even have a fainting or collapsing episode.
So it's dangerous, it can be dangerous.
It can be eventually dangerous. And we can identify it by listening with the stethoscope. So you can hear a murmur as the blood goes across that valve.
So are there any special arteries that come off the bottom of the aortic valve?
Right, so the first 2 are the coronary arteries.
So they come off the aortic valve?
Right, just beyond the aortic valve or the coronary arteries or the heart arteries, blood goes back to the heart. Then probably the next important are to the brain, say the carotid arteries that go to the brain.
So if you've got stenosis of the aortic valve, you have difficulty getting blood supply up to the brain?
You can, and that's the idea about passing out or fainting or collapsing.
Is it easy to, can you see a patient come in your office and say this person has aortic stenosis right away? How quick is the diagnosis made?
So we're pretty good with the stethoscope, just listening and identifying aortic stenosis. But the tool that really defines it well is the ultrasound, which is called an echocardiogram.
So what does the echocardiogram look like in aortic stenosis?
Right, so the echocardiogram is really just a microphone, ultrasound images of the valve. And so normally the valve, with every heartbeat, the valve opens, wide open. And with aortic stenosis, it opens that much, that much with every heartbeat.
And you can see that, that's a great description. You can see that on an echocardiogram.
Yes.
So that's an important part of the evaluation.
Very essential.
So you've got an aortic valve that's stenotic. That means the blood has a hard time getting through.
Yes.
What about if the blood comes back from whence it came? What's that called?
So that's called aortic regurgitation. So sticky valve, stenosis, leaky valve, regurgitation.
When we say leaky valve, do we usually mean the aortic insufficiency?
Yes, so aortic insufficiency or regurgitation, where it comes back to the heart in between heartbeats.
And so that's more difficult for some people to hear when it comes back like that?
It is. That also has a murmur, but the murmur is much softer and it's between heartbeats.
So it's lub.
That's
and
right.
It just sort of fades down there. What are some of the signs that you see of aortic insufficiency?
Well, that has some unusual findings where the top number of the blood pressure versus the bottom number of the blood pressure can be very widely spread.
So that's called pulse pressure.
It is
and
the pulse pressure
gets wide.
It does.
For instance.
So you can detect that, like you said, in the carotid arteries. You might feel it in the pulse in the wrist. Believe it or not, you can see it in their forehead sometimes.
Oh my gosh! So it's head bobbing
like
because
that.
Bang!
Right.
And that's because the heart, the leaky valve, brings more blood back to the heart, and the heart therefore pumps a large volume.
It does, yes. It's a volume overload to the heart, whereas aortic stenosis is a pressure overload, and the heart muscle gets thickened. It's like lifting weights and your muscles get thickened.
So that's aortic stenosis, aortic insufficiency. Symptoms, heart symptoms that somebody has would be what of those two, both of them?
The symptoms can actually be similar. So I would say the most common symptom would be shortness of breath. It's not specific for the valves, but people develop shortness of breath as the valve has trouble. Again, you can have chest discomfort. The collapsing part probably has to do more with aortic stenosis than the regurgitation.
Are you able to run a race?
You would have difficulty.
So you have exercise intolerance.
That's right.
You can't really be overly active, so you can't really run out and jump up and go up Mount Lacan or anything like that.
That's
because of exercise intolerance. Let's jump over to the pulmonic valve.
Mm-hmm.
What's that?
So the pulmonic valve is similar to the aortic valve, but it's on the right side of the heart. So the right ventricle pumps through the pulmonic valve to the lungs.
Okay, and so it's on this side, whereas the aorta is on that side as far as listening goes. Same basic principle of, do you have pulmonic stenosis?
You do. It's much less common. We see that more in children than we do. So aortic stenosis, more in adults, especially more elderly adults. Pulmonic stenosis would be mostly in children, in young people.
So in children, what happens to the blood pressure in the lungs with pulmonary valve disease?
Well, it can affect the blood pressure in the lungs. And the right ventricle normally pumps against very low blood pressure, but with pulmonic stenosis, the right ventricle can become thickened, right ventricular hypertrophy.
So with the aortic valve, that's the left ventricle,
Yes.
the big pump. So the little pump, the right side of the heart, is responsible for pumping blood to the
lungs through the pulmonary arteries.
So you can get the same insufficiency and regurgitation with that.
You can also have pulmonic regurgitation as well. Yes,
Is that
that's
easy
right.
to hear?
No, it's harder to hear on the right side.
Yeah.
It's a softer murmur. It can be a little tricky.
Can you find it easy on testing like the echocardiogram?
So the echocardiogram, yes, is excellent. That's really, again, the most important tool for finding these valve lesions.
So if I said the heartbeat was lub-dub, what's lub and what's dub?
That's the first heart sound and the second heart sound. The lub is the mitral valve closing, and the dub is the aortic valve closing.
So you have to listen carefully for the lub-dub and then figure out what the abnormal sounds are coming before and after that.
Yes.
Okay. Other valves cause problems?
They do, particularly the mitral valve.
And that's what we're going to be talking about when we come back. The mitral valve, where's the mitral valve? Have you ever heard of mitral valve prolapse? Most people have mitral valve prolapse on an echocardiogram. What is it? How important is it? And what does it mean to you and your health? We're talking with Dr. Malcolm Foster, board certified heart specialist. We've been talking about the aortic valve, a leaky valve, and a stenotic valve. Same thing goes on with the pulmonic valve, which throws blood, its pump, up to the lungs, whereas the aortic valve throws blood out to the rest of the body. Now we're going to be talking about the mitral valve. Mm-hmm. I hear a lot about mitral valve. Where is the mitral valve? What does it do?
So the mitral valve is between the left ventricle and the left atrium. You know, the upper chambers of the atria, lower chambers of the ventricle, and the mitral valve separates the upper and lower chambers.
So does it do a good job?
Generally, yes.
And if there is a murmur, do you call it a mitral valve insufficiency or prolapse, or what happens?
They can have both. So with prolapse, for example, there might be a click, but with insufficiency or regurgitation, there's a murmur. With every heartbeat, instead of the blood going out, some of it goes backwards to the left atrium.
So it's got a characteristic murmur.
It does.
Tell me about it. What's characteristic about mitral insufficiency?
Well, we call it sort of a blowing murmur, and it goes towards the side or even towards the person's back.
So if we've got lub-dub, and dub is the mitral valve normally closing, and it doesn't close because it's insufficient, what's the heart sound with mitral insufficiency?
Right, so right between the first and second heart sound, you'll hear a blowing murmur. It's one of the systolic murmurs.
So it's lub, lub.
Yes. There you
So
go.
it immediately, you don't really hear the second sound because you just hear the blow.
You may not, that's right.
And why do you hear it in the back?
Well, the left atrium is a posterior or back structure, so the sound can transmit towards the back.
So is that easy to hear or hard to hear? It depends on the murmur.
Yeah, it's generally fairly easy to hear, especially if somebody's relatively thin. If they're a big chest, it might be harder to hear.
So I hear a lot of people say, my doctor says I've got a mitral insufficiency. Is that usually mitral valve prolapse or mitral insufficiency?
Yeah, so mostly it's just a mild leakage across the mitral valve, and that's actually very common. Echo is so sensitive that we pick that up very often.
So it's a common diagnosis to come at the end of the exam. You've got a little mitral valve disease, it's insufficient, the blood comes back from how it got there. The tricuspid valve?
The tricuspid valve is similar on the right side of the heart. It separates the upper chamber, the right atrium, from the lower chamber, the right
Let's go through that
ventricle.
a little more slowly.
Sure.
It separates what?
The right atrium and the right ventricle. The tricuspid valve is between those chambers.
So if one is stronger than the other, has greater pressure, it goes to the path of least resistance?
It does. So for example, if there's tricuspid regurgitation or leakage, that would be back to the right atrium.
Is that easy to find on an echocardiogram, or is it easy to find when you're examining the patient? Or what happens when you're examining the patient with tricuspid insufficiency?
Right. It's a little bit tricky, and sometimes it can be confusing, mitral regurgitation versus tricuspid regurgitation with the stethoscope. But with echo, it becomes quite obvious, the right side or the left side.
So the echocardiogram is really a huge game changer for the cardiologist.
Absolutely.
Because they can, with an echocardiogram, do you see the blood flow?
You do. I tell you this, Dr. Bob, going in the future, instead of a stethoscope, I think people will have a small echo in their white coat pocket, and they can put the echo on the heart and take a look.
So that's going to be modern technology, your cell phone, and you
Correct.
hook up. So what would the wires coming out of the cell phone, what would they be like, and what would they be doing?
Yeah, so it's actually Bluetooth. So you put the microphone on the chest and you look on your smartphone, and you can actually have images of the heart.
So we've got some big changes in the future.
Yes, that's going to take place at the stethoscope.
So we've got aortic valve disease, we've got pulmonic valve disease, we've got tricuspid disease, we've got mitral disease. What is how do you fix those things? Is there anything we should know? Here we've already talked about echocardiograms and some of the newer things. What should we know about treatment in the future of heart valve surgery, I guess?
Well, believe it or not, some of the future is now. It used to require open heart surgery to repair or replace a valve. But now, most of the valve procedures can be done through a catheter procedure. So
It's called non-invasive?
yes, sure, minimally invasive catheter procedure.
So you go up through the groin and you do a cath and you go back. How do you get inside the heart when you do that?
Well, you navigate under X-ray guidance. And for example, the aortic valve, you can replace the aortic valve. That's called TAVR, T-A-V-R. So you go across that narrowed valve and you implant a new valve that's within a stent with a nice flexible valve on the inside.
So I hear about TAVR all the time, and I see patients that have had a TAVR. So is that I can't say is it difficult, since you're doing it with a cath and you open it up and does it do a good job for replacing the aortic valve, the TAVR?
It's excellent, and it literally immediately gives results to the heart. So the heart that's been pumping against that narrowed valve immediately now has easy flow from the heart into the aorta.
So what does the patient tell you when they get immediate change in their stenotic valve?
They literally have relief, before they ever leave the hospital.
That has to be one of the greatest feelings you could have. Yeah, I think I'm going to die. I need your help. And you say, here you are.
They do. They leave the hospital pink and happy and breathing comfortably.
What a wonderful thing to be able to say. So how excited are the patients when they suddenly pink up and they say, thank you, Dr. Foster?
Yeah, it's wonderful. And it's been a very durable procedure. We didn't know how well it would hold up, but we now have TAVR valves that are more than 10 years out and doing very well.
So can you do the same thing with the mitral valve? It's open and the blood goes back from whence it came. Do you have a MAVR?
Yeah, so TMVR, yes. That is one of the options. And there's also another option that's minimally invasive, and it's called a clip, a mitral clip. And that just brings the leaflets together and reduces the amount of leakage across the mitral valve.
Effective?
Very effective, yes.
Symptoms change when you do that?
Yes, probably not as dramatic as the TAVR on the aortic valve, but still people get better almost immediately, less shortness of breath, and their symptoms improve significantly.
So we've gone through the aortic, we've gone through all the other valves, we've been into the mitral valve, we've been to echocardiograms, we've been able to see what's going on. In general, we talk about exercise, laughter, 7.5 hours sleep, socialization. How important are those things as far as your being a physician?
They are essential, and I recommend them to all my patients.
And we'll be talking about that when we come back. A lot of information, and hasn't it been great? You'll want to stay tuned. We're talking with Dr. Malcolm Foster, and we've been talking about heart valves. We've talked about the aortic, the pulmonic, the tricuspid, the mitral. Probably the ones that I feel most people are aware of is aortic disease and some of the changes with that, but also the mitral valve. So what's a mitral click? What's a mitral insufficiency? What's mitral valve prolapse? How are they different from everything else that we've talked about? So I'm almost going to say, Malcolm, take over. Let's talk about either the aortic or the mitral valve. Tell me which one you want to start off with.
Well, let's talk about the aortic valve.
So the aortic valve is on the right side of the heart as we're listening, and it's got a stenosis and insufficiency. The coronary arteries come off the bulb of the aortic valve. So tell me where our problems are.
So if that aortic valve becomes narrowed or sticky, aortic stenosis, the heart has to pump against that. The valve doesn't open properly. It barely opens. The heart becomes thickened. We call it a pressure overload, and the heart becomes thickened and stiff as it tries to pump against that gradient.
So it can even be stiff where it just ain't working very good.
Yeah, very much so, yes.
When you're listening or when you look at some of the studies, what happens to the pump, the left ventricle?
Right, so it gets thickened, and the person with a thickened left ventricle can have shortness of breath, we call dyspnea, they can have chest discomfort, and it can even cause arrhythmias of the heart that can be serious, and a person can actually collapse.
I was going to get into, can it cause the heart to stop?
It can.
What happens to the coronary vessels if the aortic valve when the blood tries to come back, it fills the coronary arteries. Is that
Right.
correct? So
Right.
what can happen? Is that how arrhythmias occur? What's an arrhythmia?
That arrhythmia is when the heart goes out of rhythm. And again, when the left ventricle is struggling against a valve that won't open, it's a setup for an arrhythmia that can cause a person to collapse or have what we call syncope or a collapse.
So is that where, when you evaluate the aortic valve, is that where you say, well, we need to do a catheter replacement of that valve?
Yes. When it gets to that point, that's the most severe. So we follow the aortic valve usually mild, moderate, severe, critical. We may not wait till it's critical. Even if it's severe, that may be enough to do replacement.
So is it difficult to figure out the exact time that you need to intervene, that you need to go to valve replacement versus, well, let's watch another month or week or day?
All right. It's helpful if we can follow the patient on a regular basis. We call surveillance. That's helpful, but sometimes people show up and the first time we meet them, we already find severe aortic stenosis.
How far away does the stethoscope have to be from the chest cage before you can hear aortic stenosis like that?
You can hear with the ear.
Yeah.
You can put the ear to the chest.
Yeah, I had a patient that walked in the office with aortic insufficiency, and you could actually hear the regurgitation murmur on the other side of the room. I was shocked.
Right.
Okay,
Right.
let's go to the mitral valve.
Yes.
So let's talk about mitral valve prolapse, mitral insufficiency, how they're corrected, what's a mitral click, what's the third heart sound. Tell me more about the mitral valve in 2 seconds.
Sure. So as the heart beats, instead of forward flow, if that mitral valve allows backflow back into the left atrium, that's mitral regurgitation or mitral insufficiency. We hear the murmur. The patient can have shortness of breath. They can also have some arrhythmias, pressure.
What's an arrhythmia again?
Where that
Irregular?
heart gets out of rhythm,
That's right.
becomes irregular. So pressure on that left atrium, the atrium, can cause atrial fibrillation, for example.
Atrial fibrillation is sort of another our show on the Dr. Bob Show. It's
Right.
one of the most common chronic irregular rhythms. Is that the way you would
By
say?
far the most common, yes.
You see that a lot of that.
We do, and to be clear, that everybody with atrial fibrillation doesn't have mitral valve disease, but with mitral regurgitation, that's one of the consequences.
And it's because the blood goes back to the left atrium, the left atrium, the chamber, the left upper chamber. It makes that big. And
It does. It
enlarges.
stretches the left atrium, and it makes it more prone to have irregular rhythm or atrial fibrillation.
So, we'll pull this one right out of the air. What's a transesophageal echocardiogram? TEE.
TEE, that's right. So a regular echo is ultrasound where you just use a microphone on the chest. A TEE, we put a scope in the esophagus, which is right behind the heart, touching the heart, and you can really see in great detail the heart structures.
So what you're telling me is more and more we're getting better and better at understanding exactly what's going on with the heart. And with a cell phone and an ultrasound or echocardiogram that can be done with your cell phone, it even makes you better, better for the patient?
Yeah, much more precise.
Okay, and so when you're doing it right at bedside, you can turn around, you can do what you want to do as far as getting that to go.
Yes.
Is that far off in the future, or is it here now?
Not at all. My daughter is a medical student.
Where?
At University of Tennessee.
Uh-huh.
And they are using ultrasound immediately for the medical students, first year of medical school.
First year of medical school. So how do they compare with the cell phone doing an echocardiogram versus the doctor at bedside?
Well, they're excellent. The images are actually very good, and most of the questions can be answered with a handheld echo, most of the questions.
And, you know, the information that I've received is the medical students outdo the senior pro doctors. We won't say that yet, but it's in the future, and it's going to be there.
Oh, it's wonderful. It's going to be a real advance.
It's going to be such an exciting part of our future. Malcolm, you're a great physician. We always end this show talking about the importance of exercise, and certainly with cardiovascular disease, when you exercise, it helps protect the heart, it helps protect against rhythm disturbances. 7.5 hours sleep, so important, because the whole body needs that rest, including the heart. Does the heart need somebody to get sleep good?
It's very important to have good quality sleep, and I couldn't agree more with you.
Laughter, where does that enter into good heart health?
I think it's very important. Hard to measure, very important.
Yeah, and the other one was nutrition, what you eat. Salt a problem?
Yes, it is a problem, especially too much salt is a problem with blood pressure, with congestive heart failure, and many things.
So if we change the world into doing what the Dr. Bob Show says of eating properly, exercising, getting 7.5 hours of sleep, and most of all, laughter, a lot of illnesses would be cured.
No question about it.
But thank you, Malcolm Foster, that we can learn about the heart and the heart valves and how important they are and what we can do about them. So that's all the time that we have for this show. It's been a great one for me. Thank you for watching.